Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people with tension headaches. Tip number 1 is learn to identify what a tension type headache is. Tension headaches are the number one cause of headaches, and stress or tension is the number one cause of tension headaches. Tension headaches characteristically feel like a pressure or a tightness. It's usually on both sides of the head. And you may also have tenderness over your head or your shoulder or neck muscles. Tension headaches are typically mild or moderate, usually not severe. And they are commonly confused with migraine headaches. Migraine headaches can occur on only one side of the head and can be associated with nausea, vomiting, and sensitivity to light or sound. Tip number 2, see a doctor. If you suspect you may have tension headaches or if you have any kind of headache, it's important to be evaluated by a doctor. For one, your doctor can identify a tension headache, and as well, you may have depression or anxiety which contribute to your headache, which can be identified and treated by your doctor. When you visit your doctor, bring with you a diary that records when you had your headache, what you ate before your headache, what was going on in your life with your headache, what your headache was like, and how long it lasted, and what you did for your headache, if anything. A headache diary is an extremely important tool to help you and your doctor determine what the cause of your headache is most likely to be. Your doctor will also be able to perform a neurologic exam to test all of your nerves and your muscles, and can perform an eye exam and potentially refer you to an optometrist for a more thorough exam. Visual abnormalities can often be a cause of headaches, and so it's important to make sure your vision is adequate, or that you have glasses to give yourself adequate vision. If your doctor finds an abnormality in your physical exam, or if you have a typically severe thunderclap headache, which could suggest a more serious underlying condition, then you may be referred for imaging. Tip number 3, don't smoke. The reason not to smoke is not exactly because it is associated with tension headaches. Smoking is not associated with tension headaches. But whenever you have any kind of medical condition, treating that medical condition is complicated and harder to achieve when you're a smoker. So talk to your doctor about effective ways to quit smoking. Tip number 4, daily exercise. Daily exercise is important for all adults, but people with tension type headaches can often have relief of their symptoms from daily exercise. Walking need only include 30 minutes a day. Our exercise need only be 30 to 60 minutes a day on most, if not all, days of the week. Tip number 5, make sure you're getting regular sleep. Regular sleep consists of at least 7 hours of sleep each day, and it's important to go to sleep at the same time and wake up at the same time. Regular or oversleeping or undersleeping can be a cause of tension type headaches, and people who have trouble sleeping should be further evaluated, as obstructive sleep apnea can also be a cause of headaches. Tip number 6, avoid excessive caffeine use. Excessive caffeine use, usually more than 1 or 2 cups a day, can be associated with caffeine withdrawal, which can also cause headaches. Tip number 7, if these behavioral changes have not been effective and you are not pregnant, women who are pregnant should speak to their doctor before taking any medication. Then you can consider an over-the-counter pain reliever. Non-steroidal anti-inflammatories are considered the best treatment, but there are reasons that people should not take non-steroidal anti-inflammatory drugs, such as stomach ulcers or kidney disease. You should speak to your doctor before taking even an over-the-counter non-steroidal anti-inflammatory. But if a non-steroidal anti-inflammatory is right for you, then consider ibuprofen, either 200 or 400 milligrams, or naproxen, 375 or 550 milligrams for your headache. An alternative for people who cannot take NSAIDs is acetaminophen, or Tylenol, 1,000 milligrams. This is not as effective, but it is an alternative to ibuprofen or naproxen. If your pain is not relieved by these single medications, you can try a combination medication, or the name brand is Excedrin, but the most effective combinations are ones that contain acetaminophen, aspirin, and caffeine. It's important to limit your use of any over-the-counter pain reliever to no more than taking it more than 9 times per month. If you are exceeding this amount, then you are at risk for medication overuse headaches. Tip number 8, referral for alternative therapies. If these over-the-counter medications do not work and all of these life changes have not been helpful, then there are 2 recommended therapies that your doctor can refer you for. One is EMG, biofeedback. This is electromyography, where you can learn to control what were subconscious processes. And this EMG biofeedback has been shown to be effective for tension-type headaches. You can also be referred for relaxation therapy, which often involves cognitive behavioral therapy, which will help you identify and relieve the triggers that cause your tension headache, and also to relaxation techniques to deal with the pain of the headache. Tip number 9, if these referrals and the pain medication I've described and the lifestyle changes I've described have not been effective, then ask your doctor about amitriptyline. Amitriptyline is a tricyclic antidepressant, and it is recommended in certain individuals when their headaches are frequent, long-lasting, and are disabling to them. And tip number 10, believe in yourself. Tension-type headaches are extremely common, and I've presented several effective therapies and lifestyle changes to help deal with tension-type headaches. I hope this video has been helpful, and thank you very much for listening. Have a great day.